I'm Harry. I'm the dad.
Hi, I'm
Hi,
Sam.
I'm
the
the
mum.
nurse.
Hi, I'm Dr. Sue Brown.
Hi, we have a patient today. She's a little girl. She's Jenny. Jenny is a 9 years old girl. At September of 2013, Jenny feels pain in her legs, and she also has fever and the breath rate raised up, and so on. After check bone marrow and lumbar puncture, she has been diagnosed as leukemia. After 18 months treatment, Jenny's situation is getting worse. However, because of the fungal pneumonia, Jenny has been in hospital for 10 days at March of 2015. For now, she has ready to go home and accept pediatric palliative care. This video will follow Jenny's journey in being diagnosed, treatment in hospital, and palliative care at home.
Mom, Dad, I don't want to go to Little Athletic tonight. I'm really tired and my legs are hurting.
Are you sure, Jenny? What type of pain do you have?
I have pain in my both legs. My muscle feels sore and my joints are stiff.
That's okay, Jenny. You must have strained your muscles from sport activity at school. You don't have to go to Little Athletics tonight.
Thanks, Dad.
Harry, don't you think Jenny is looking a little pale?
Yes, she did. I've also noticed she hadn't been showing her usual interest in food.
The next day, Sam decides to call her mother for advice before calling the local GP clinic. The first arrival appointment was on the Tuesday at 10 o'clock.
Hello, COS family. I'm Dr. Sue Brown. I have a diploma in paediatrics and a keen interest in healthcare for children and adolescents. I haven't seen your family in a while. What can I help you with?
Well, the past few days, Jenny has felt unwell. She has lost her appetite and has pain in her legs. By the time we arrived at the surgery, I'm becoming quite concerned. Far from recovering, Jenny has become more lethargic and irritable.
Okay, Jenny, can you please get up on the examination table? I can notice that Jenny is very pale, mildly febrile, and her respiratory rate is elevated, and she's quite lethargic. So I'm going to take a few tests. So I'm going to test the urine and do a full blood examination to check her white blood cell count and her hemoglobin levels, as well as showing anything abnormal as well. Hi, how are you, Harry, Sam and Jenny?
Hi. Well, okay, but just been a big shock, and we found it hard to come to a term with how it happened.
Well, that's completely normal in this situation, Harry, but there's a lot of different support out there for you, Sam, the kids, and other family and friends to further understand. This support can include lots of information about the disease, how it occurs, what can be expected in terms of common side effects, and anything else you want to know about the biology of acute lymphoblastic leukemia, also known as ALL. These can be in the form of booklets, websites, question sheets, or personal responses from individuals such as me, Dr. Brown, or any other doctors. Could also refer you to an ALL specialist to answer further questions for clarification. The booklets can be for siblings and yourself for how to understand and cope with their siblings or your daughter having ALL and what may happen in the future. There are also multiple support classes and education programs that run through the Leukemia Foundation that you can attend if that suits you better than websites or booklets. Financial support from places such as Red Kite are also available if needed, as there can be a lot of coming strain on the family. There are also groups and supports for Jenny as well, such as Make-A-Wish Foundation, the Leukemia Foundation, and Camp Quality.
There's so much. I don't think we'll be able to keep up.
It's okay, Sam. I know that there's a lot of information to understand, but you don't have to look or take it in all now. And if you have any questions, we're here to help and direct you where to look throughout the whole process. There are also helplines that are 24 hours, so if you ever need to talk or ask anyone, that can be a great support for you. There are also children's helplines that the siblings can access.
Thank you.
Sorry, I don't understand what palliative care is. Can you please explain it to us?
Palliative care is not only about end-of-life care. Palliative care is holistic care that aims to release Jane's symptoms and improve quality of her life by addressing physical as well as emotional, cultural, spiritual, and social needs. Importantly, it also includes care for you guys, for the family and the friends.
Who was going to take care of my daughter?
Well, palliative care nurse and palliative care doctor, pharmacist, dietitian, and physiotherapist, social worker, and bereavement counselors, and other volunteers. We are going to take care of your daughter, and we are going to provide care and support to Jenny and your family.
Are you guys 24 hours reachable? Oh my gosh, I'm so worried. What if something happens and you guys are not there?
Don't worry, Sam. We are on call. Although home care-based palliative care is only provided on part-time, but we're all on call if there are any emergency. Also, the home visit is regularly scheduled or continual basis. We also will provide emergency kit of few basic medication in 1 to 2 doses for common crisis situation, can prevent needless fear and suffering with timely response until help can arrive from a home care nurse. And also be aware that there is always hospital bed available if, for any reason, you feel hospital care is more appropriate for Jenny.
Should we tell Jenny what's going on? Can we discuss it with her?
Oh yeah, you can generally talk with Jenny to see what she thinks. But because she's under 16, so according to the advanced care, that parents have to make all decisions. But it's good to talk with her and discuss with her.
Nurse, will I get in lots of pain when I die?
Well, Jenny, there's no absolute indication that death is always painful. If you feel any pain, you should tell us or tell your family. We will help you. Don't worry.
Thank you.
Jenny told us she's lonely.
Is there anything we can help Jenny?
Yes. She might be afraid that you guys are unable to cope with her death, will abandon her. I think she would love someone who she knows and trusts to stay with her. Just simply present of you provide support and comfort. Neither words or action are necessary unless she requests something.
Yes, we can keep her company, and can we hold her hand?
Yeah, of course. That's an easy way to provide her a sense of security. Hi, my name is Jillian and I'm doing the palliative care. And we give the explanation of what palliative care is and what the home care-based palliative care like, and how a nurse can comfort and influence the family and the patient.
Hi, I'm Abby. So I did when Jenny was in the hospital, basically outlining how nurses have all the resources to be able to direct the patients and their families and their friends to the support and information they need to be educated, and to push them to start looking even if they don't know where to go, or especially if they don't know where to go. It also helps clarify the situation and this highlights how the nurse can either aid or hinder the healthcare seeking behaviours of the parents and Jenny, because if they don't tell them the information and they're lost, they're not actually helping them. It's also part of a nurse's job to do that and meet standards. It's also highlighted the barriers between communication with nurses, doctors, and kind of financial barriers and emotional barriers between those two, and having to deal with all that stress and become educated.
I'm Mia. I did the visit to the GP to see Dr. Brown when they were worrying about Jenny and her condition and seeing what it was. So the general practitioner will have the centre role to support the well-being of the family with the diagnosis of the child. They are often responsible for making the initial diagnosis and will organise relevant testing to determine what type of cancer it is and the likely timeline of the disease.
Hi, I'm Yi. In this assignment, my job is make an introduction to introduce Jenny's situation and some backgrounds. And besides that, I still do some editing job to collect some materials and make these videos. Yeah.
Cool, thanks for watching.